Good morning. Always nice to have you join us here on 3+U, and we hope your day is off to a great start. If you are new to town and you're watching us from among the first time, you're going to learn a lot when you watch this show. If you have been born and raised here and you count yourself among the blessed, then I'm sure you also learn a lot to celebrate our town when you watch our show. Ray Bond, I think, kicks it off as a great example of what the community really looks like in Chattanooga. Ray is with Project Access, and she's here today because this year you celebrate your 20th anniversary. Is that right?
20 years of serving patients in the region.
So I think that one of the themes, if there is one on 3+U that seems to happen, is that if there is anything you want to do, whatever your particular passion is, Chattanooga seems to be a community where you can have it come to fruition. We're a real grassroots community. Project Access is a great example of that because it's a passion of yours and the physicians who bring this care to people who would otherwise be overlooked.
Absolutely. And basically Project Access, which started, we just finished 20 years of service. It's a clinic without walls. We provide access to specialty care for low-income and uninsured folks in our community. We partner with primary care homes like Volunteers in Medicine and 27 other clinics. We actually work with 28 primary care homes. And when somebody needs advanced care and specialty care, they can refer them to Project Access, and we help coordinate their care. We have 1,160 volunteer physicians at the moment.
So she's been doing some math as these 20 years have gone along. So how much care have you provided in the course of those 20 years?
We have coordinated $233 million of donated healthcare services, and it's a partnership. The physicians are a major part, but it's also a partnership with Erlanger, CHI Memorial, Park Ridge Hospital, and then 2 years ago, Tenova in Cleveland joined our network.
So what this means is, because it does get a little bit confusing, you walk these almost parallel lines, Project Access and Volunteers in Medicine. You are the specialty care?
We're the specialty care and hospital care, lab services, some testing.
Okay, because what has happened to in the course of the last, I don't know, almost 20 years, I guess, since the Affordable Health Care Act became law, I think a lot of people believe that everyone has health insurance. But there are still gaps. Is that right?
There are big gaps. Yeah, basically the Affordable Care Act provided some, it does provide better access to insurance, but there are some gaps, especially if you're low income, the way it was constructed and with Tennessee's decisions on expanding TennCare. There are a lot of folks who don't get any financial assistance to buy insurance, and so they're absolutely priced out of the market. And a lot of our patients, our income level is 150% of poverty. And a lot of our patients even are working. Some of them work 2 part-time jobs. They never qualify for insurance through their employer, or their employer doesn't offer insurance.
Sometimes even when the employer does offer insurance, it's just almost cost prohibitive. So how does a person qualify then for Project Access?
Well, we basically work with primary care doctors. So if you've got a primary care home, the doctor you've been seeing, or any of the community health centers, when they have somebody who needs access to specialty care, they actually send us a referral, tell us what kind of specialty they need, what kind of procedure they need done, and then we match the patient with the appropriate referring facility. It sounds easy. It's a little more complicated than that.
Okay, but let's make it like an everyday practical application. Okay, so let's say you're a 36-year-old single person. You have a job, but the insurance is expensive, and so you're going to just self-pay. So if you get sick and you want to do a well check, you're just paying out of pocket, and you can cover that. And then the unexpected happens. And now you need that specialty care. Could they possibly qualify?
They could qualify. It depends. One of the things that depends, we look at the affordability of the insurance. We look at a person's income and the affordable. So if
I hear you.
Yeah, so
it's a scale. It's a
scale. So but if it's truly not affordable. So sometimes people have had insurance and they've been laid off, and even if they qualify for COBRA and their unemployment is $750 a month and their COBRA is $1,000 a month, it's easy for us to say that is not affordable for this person.
Right.
So we really focus on folks who are uninsured, and we do a financial eligibility check. The hospitals partner with us because we do good be sure that people qualify.
Yeah.
And it's really a very beautiful thing.
Are you funding this? I have to wrap it up, but are you funding this through doctor donations, like they're giving of their time, or do people donate to you?
We receive contributions. We have some grants because we have a staff of care coordinators helping people get to their appointments, understanding what they need, keeping the recruitment, scheduling the surgery, scheduling everybody around that. So we actually have a staff, and so we have grants that we apply for, and we do get private contributions to the medical foundation.
It's a frightening thing when you're having to choose between, do I take care of my health or do I put gas in my car?
It's a very frightening thing.
Far too many people have been there.
Yes, they have.
And so good for you for trying very
Thank
hard
you.
to eradicate the problem. She said her hope is that 20 years from now, there's just no more concern for them to even be here because everybody has that access.
That would be a beautiful thing.
To the healthcare. If you do want to learn how you can get involved, whether you might be in need of services or you would like to help them in some way, there is their phone number. You can also go to their website as well. Congratulations on 20 years.
Thank you.
Do you really know what you're getting when you buy bagged planting mix? Visit Winwood Bulk to learn how our locally made black gold mix